podcast. I would like to ask you that I was reading some data, and there has been, on an average, dip in the number of the COVID cases in the last 1 week. There has been a big debate that whether national lockdown should be implemented or not. But do you think that the decline in the cases, the dip in the positivity rate, is basically because the many states have implemented lockdown or corona curfew?
Yes. So that is one important factor why the cases have started to go down, because most of the states where there was which were contributing maximum to the cases in India have been in lockdown for the past 2 to 3 weeks, and some places are in night curfew. So that is one important reason where the spread of the virus has halted. Second thing is that with so many cases in states like Delhi, Uttar Pradesh, Karnataka, Kerala. So currently, specifically Maharashtra now, like Maharashtra is going down. It had reached till 67,000 cases per day. It's now around 40,000 cases per day. So when too many cases happen in a short span, so a few weeks after that, the peak starts to go down because too many people have been infected in the recent past. Second is that this also imposes a kind of fear in people, and COVID appropriate behavior is followed little better than what it was before. And definitely with closing down of malls, closing down of restaurants, imposition of lockdown, it helps and goes a long way in curtailment of the spread of the virus. So what we are seeing in the last 1 week or so is probably now we are going down from the peak, and hopefully it should continue that way. But that does not mean that we give up on our guard and we stop, behaving responsibly. We still have to follow COVID-appropriate behavior. Vaccination process is still in place. Not too many people have received both the shots of vaccine. So, please, right now also, we still have to keep our guard up. That is very important.
Yeah, Dr. Richa, I would like to ask you that since we are into the second wave, last year when we saw the first wave, there were many states which were the hotspots like Maharashtra, Delhi, many places in North Delhi especially. Now this time what we are seeing, especially in Karnataka, Kerala, Tamil Nadu, so the states in South India are, recording many cases on a daily basis. So why is that so that in South India this time the second wave has hit?
No, it's not that it hit in the South India only. It hit almost the entire country, and in places where it has not come in the last month, it's going to come now. What happened last time was that there was a complete lockdown. There was no interstate transportation happening. But in the current scenario, even till recently, most states are allowing you to travel from one place to another. There is no nationwide lockdown. Movement is possible. So it is coming in all states. It is just the timing that is different. Maharashtra was the first one to start peaking. Then it spread to the North Indian states like Delhi, Uttar Pradesh, Punjab. And now in Kerala, Karnataka, probably in 2 to 3 weeks, we'll see a decline in Kerala, Karnataka also. But it has hit almost everywhere. And now so there is news that it's going to the rural areas also, which will pose a challenge in the coming days.
Dr. Richa, now this time in the second wave, the black fungus has come into effect. It has been reported in many states, and there was a very big debate also on our channel also whether the vaccine is effective or not. But do you think the number of increasing cases of black fungus in many states could be a matter of concern in the second wave?
Absolutely. So black fungus, or what we call it in medical terms, mucormycosis, is a very, very virulent kind of a fungus. It has a very high mortality rate to the level of 40 to 70%. So mostly it is of two forms. One is the pulmonary form, where it affects the lungs, and second is the rhinocerebral form, wherein it affects the nose, your sinuses, and your brain. So it is considered to be a very, very virulent fungus with very high death rate. And specifically, if it is occurring in post-COVID cases where already the person's immunity is very low, so it amplifies the mortality in death. Definitely in the last few months, in the last wave also, there were some cases reported of mucormycosis, but in the current scenario, we are seeing it from everywhere. The causes of it is multifactorial. One is that definitely COVID itself is a condition where your immunity goes down. Second is use of long-term steroids, high doses of steroids. as well as use of immunomodulator medications, which are a must to control the inflammatory phase of COVID, results in deranged blood sugars and your predisposition to fungal infections. So definitely it is a cause of concern, and here we have to, remember that steroids is not something which you can get over the counter, which you can take without any fear. So one has to be very cautious in prescribing as well as taking steroids, because the benefits as well as risks are there. And with black fungus coming in, the risks are far more.
Okay, Dr. Richa, that was some very fruitful and big information which you gave on India Ahead. Thank you speaking to us and taking out your time. Moving on to another news.